For those of you just joining us, I'm Cory Busse. I'm the Vice President of Performance Strategy at Icario, and I am joined today by, there we go, Louise Briguglio, who is our SVP of Integrated Experience. We're going to talk a little bit about today the future of rewards and behavioral research with respect to, specifically in this session, driving annual wellness visits. Just a brief commercial about who we are. As some of you may already know, back in October of 2020, Novu Health and Revel Health joined together in a merger to form Icario. And we are experts at driving member engagement, particularly in the space and government programs. And our mission is to make the world a healthier place, one person at a time. We want to sort of level set, if you will, on why we're stressing the importance of annual wellness visits in particular. As probably everyone in this session is aware, annual wellness visits are a critical component of member health on an ongoing basis, hence the term annual, right? So one of we wanted to sort of level set around the reasoning that we have for hosting this session today. We were talking just before we started about how the pandemic has sort of upended everything, including things like RISE, right? A year ago, we were all anticipating doing this in person, and RISE pivoted to this sort of a format where we are virtual. The same forces that forced that also had a major impact on what created a trough in healthcare utilization over the course of the last 12 months. We saw in the last, over the course of the pandemic, 41% of members going without needed care. So a broad definition there, but between March and mid-July of last year, roughly 41% of your members were saying that they were going without care that they themselves identified as needing. Cancer screenings were down by about a third over the course of the last 12 months, depending on the cancer type. And vital vaccinations, particularly those in children, dropped by about a third as well. In fact, the CDC just this week released a report that said that orders for childhood vaccinations were down by 11 million doses over the course of the pandemic, which is a disturbing trend, to say the least. Chronic conditions have been left unmanaged largely in blood sugar and cholesterol and lipid tests, down by almost 2/3. And even something as critical as emergency room use, which you wouldn't expect to be necessarily impacted by a pandemic, dropped by more than 42%. And then last but not least, with this reduction, with this trough in healthcare utilization, we saw that providers were uniquely hurt, and your carefully cultivated provider networks were affected as more and more independent providers and others were either taken up by mergers and acquisitions with larger health systems or forced to close their doors altogether. In addition, with visits down, the capture of hierarchical condition codes that are important not only to member health, but to your payment for managing members' health in a capitated environment were down as well. We figure that in a typical year without a pandemic, roughly 20% of your member population in Medicare Advantage is going un or under-coded. That number will be important here as we come up to a little bit of illustrative math here going forward in the subsequent slides. One of the reasons that we know that annual wellness visits are super important go beyond the simple visit itself. We also know that annual wellness visits serve as something of a gateway drug, if you will, to other healthy member behaviors. In our experience, with more than 50 health plans and 15 million members in Medicare and Medicaid, we find that members who actually undergo an annual wellness visit are almost 10.5 times more likely to close another critical gap in care downstream from the AWV. So as you can see by the chart on the right, and these are our specific experiences we've had in aggregate for all of our programs at Icario, everything from diabetic kidney exams that are the procedure that goes that benefits the most from an AWV, 16.5 times more likely to get a diabetic kidney exam if you first receive an AWV, all the way down to something like a bone density test, a notoriously difficult star measure to move. Bone density tests, 7.8 times more likely to get a bone density test if you've already received an annual wellness visit. My goal in showing this is to demonstrate that in our work with health plans across the country, we picked one in particular. In this particular national payer, a name that you'd recognize, we had a total population of some 647,000 members. Of those members, roughly half were targeted for intervention with a member engagement program because there was some suspicion that that member was un or under coded. And so within that total population of 647,000, we figure that roughly 328,000 were or undercoded in some way. But then we thought, okay, maybe we're being even too aggressive at that 50% mark. So what would we reasonably expect to capture with respect to our interventions, or what percentage of that membership is genuinely or undercoded? So we reduced that number further, and we figured that even within that population, probably about 20% of the members were or undercoded. So what that left us with were roughly 65,000 members. And what we learned from some consultation with Milliman, the nation's leading healthcare actuarial firm, is that if a member is or undercoded, they typically have 1.9, almost 2 codes that they are missing or that are miscoded. And the value for each of those HCCs is a conservatively estimated $1,180. So as you can see, at 147, call it $1 million, even a fractional component of your membership going or undercoded for hierarchical condition codes can have a huge economic impact, not to mention the health impact that it's having on your membership. That is my sort of academic, if you will, level set. In order to arrive at why annual wellness visits are so important. Louise Briguglio is going to take you through some of the, a peek under the hood, if you will, as to the nuts and bolts of how to get members motivated to take action in their AWV. Louise.
Great, thanks, Cory. So yeah, in fact, under the hood, we're kind of going to go under the hood of the human brain. So want to talk to you a little bit about how people are motivated. I will say one of the hardest things when you're trying to get people to go see their doctor and get that annual wellness visit is that you're asking them to go see the doctor when they're not sick. And that's actually a weirdly abstract thing to ask of people when you're trying to get that. They may rationally understand all the reasons they should do that, but actually creating sufficient motivation is pretty challenging in that scenario. So that's the number one kind of obstacle that you have to overcome when you're trying to get them to take action. So we're actually, this is a somewhat misleading title. We're actually going to give you 2 approaches for how you can potentially get your members to get into the doctor. So if you go to the next slide, Cory. This is the secret recipe. So I've just exposed all of Icario's secrets to you. The thing that's important to understand is that people will definitely act as long as their activation energy or their desire to do the thing is greater than the barriers preventing them from doing the thing. So when we're talking about barriers, we're talking about logistical things. You know, do I have reliable transportation? How far away is the doctor? To social determinants of health. Things about health literacy, et cetera. And in fact, that's one of the things that I'll kind of keep emphasizing is that a lot of the time when we're reaching out to people, you know, people in the healthcare industry, trying to get them to act, you start with education. And 99% of the time, education is actually about barrier reduction, you know, telling people where they can go, how they're going to get it, the facts they need to know to have a better conversation. What people are skipping is that first step, which is about creating a desire to act. So we're going to talk to you about a couple methods there, but before we do that, if you want to go to the next slide, it's helpful for me anyway. So here's a helpful mental model. It's kind of like physics. You can think about your members as a ball at rest, and they're not going anywhere until you give them a push. That push is the activation energy. Now, if someone has big barriers in front of them, they need a bigger push to get over it, right? It's intuitive when you look at that top picture versus the bottom picture. You're going to need a bigger push to get over those barriers. Those barriers can be really personal, but keep in mind, sometimes those barriers are about the activity itself. You know, it's a much bigger ask to ask someone to go get a colonoscopy than it is to ask them to go in for a physical. So these are the kinds of things we're going to talk through and how you can start to think about your kind of push mechanisms and then your barrier reduction mechanisms on the other hand. So when it comes to pushes, you've got 2 different methods. You can do extrinsic reward, which is the idea of a carrot. So, right, that creates a desire to act because, ooh, I'm going to get a reward. There's also intrinsic methods. So I apologize. I'm sure you're hearing my very huffy dog. She's applying some extrinsic motivation to me, trying to tell me I need to pay attention to something. But you also have intrinsic methods, which is basically you're creating a desire within a person to act. And you can use both very effectively. And we'll kind of talk about those 2 different methods. So let's start with extrinsic. So extrinsic, you know, very obviously, it can be rewards. So that's what we'll talk about. If you are interested in using incentives, there's a couple of things I think we would advise you to keep in mind. Incentives certainly create motivation. What you'll want to think about if you're considering an incentive strategy is think about your ability to create impact, right? You know, if you're putting incentives toward the problem, you know, are you going to be able to move the needle? What's it going to take to move the needle? What are you asking of that member? Are you asking them to overcome big barriers or relatively little barriers? Another thing that will be really important, of course, is what you want out of it. So think about your measurement strategy. You know, if ultimately this is about improving stars ratings, you might actually apply a different strategy. If you say, you know, we're really trying to get all the way, you know, to the next threshold versus we're sort of trying to protect our current stance. You know, all of this can indicate a different reward strategy, different amount of reward spend. And the last point that I would make really ties closely to that idea of motivation and how to calibrate it just right. I know these charts are hard to see, but what it's really showing is that the bigger the ask, again, the bigger the barriers, the bigger the reward needed. So for example, right, if you want somebody to get a flu shot, that might be one incentive. If you want them to get a colonoscopy, you might be looking at a $25 reward or even a $50 reward. But know that even there, you can go too far. So at a certain point, you know, that incentive actually doesn't get the results you want. So you can and people regularly do, you know, overpay for incentives. So again, really understanding how much activation energy do I need to apply to overcome the barrier of this ask. So next method, let's talk about this really quickly. This is a different one. So now we're going to start using, intrinsic motivation. So imagine you're trying to get your members to go see the doctor, but imagine instead of just saying, hey, I need you to go see the doctor, you're doing outreach and you're actually asking them to take an assessment. So this is actually a program that we offer with good success. So that feels a little bit weird, right? Start with an assessment. So, okay, I'm your member. I'm going to dive right in. First thing I'm going to say is, yep, I feel good about taking this assessment and I'm ready to get started. Why did I join the plan? We're getting to know each other. I'll answer that question. And then the next question is actually the important one in the context of this conversation. So really early on in this experience, we're saying, when you think about your health, is there some goal you'd like to achieve? So a lot of people, you know, particularly your people who are in kind of the lower to mid of the risk profile, they don't really identify as unhealthy. And so, right, when we start having a very clinical conversation with them, they sometimes kind of reject that or feel like it's not for them. But I think a lot of people would say there are things they could improve in general. So what I'll say here is, yeah, I totally could have more energy. You know, now that you bring it up, who couldn't? So I'm going to say, yep, there's something I'd like to improve. It's having more energy. Now I'm going to move into some more clinical questions and we can just kind of pace through this. But keep in mind what I said about wanting to have more energy. Because the next important part of this, I mean, you know, it's all important if you're the plan asking for this data, but from a motivating the member perspective, the next important thing is when I get to the end, because you've sort of opened, right, you've opened the door for a conversation like, well, you know, I wasn't feeling unhealthy. I wasn't feeling like I needed to go to the doctor, but I would like to have more energy. And so now what you're doing is you're repeating my goal back to me. So in this action plan that immediately follows the assessment, it's saying, you're right, having more energy would be great. And then every recommendation that now comes in this member action plan is sort of in the context of having more energy. So that having more energy created activation energy in me. Okay, I want to have more energy. And now what you can do through the rest of this experience is you can try to reduce those barriers. You know, how do I get in touch with my doctor? What do I need to be talking about when I'm seeing with my doctor? What if I need help scheduling? You know, is there a service I can call? What are the things we should be talking about? You know, if I said in that assessment, I haven't had a colonoscopy, I can now promote it. So right in this example, you can kind of see that interplay between creating a desire to act and then also moving into reducing those barriers. So this again is not an example of extrinsic motivation, but rather intrinsic motivation, tapping into my own desire to act. So I know that was a lot, probably a bit of a fire hose, but just a reminder of some of these takeaways. You know, it's really tempting to go straight to education. We have a lot of good information. We really want members to know it all, but usually education is about barrier reduction, and we need to start often with emotion and creating that desire to act. Think about both of those things equally. On almost any ask, you're going to have to do a little bit of creating activation energy and a little bit of barrier reduction. And then two, think about the fact that you have two different strategies to apply, both extrinsic and intrinsic motivation levers, and you can use them together, right? I'm sort of presenting as if they're two options, but they absolutely can and do, and we often use them in combination. Any last thoughts that you want to share with the group, Cory, before we?
I would just add, we have a case study here from Blue Shield of California that we'd be happy to share with you. If you'd like a copy of it, please just throw a quick note into the chat where we'll be happy to follow up with it. What it does is it sort of exemplifies exactly what Louise has been talking about here. For Blue Shield of California, they had a pair of issues at work. One, they were trying to rectify lower performance in stars and quality bonus payments, but then they also had a specific interest in gauging member satisfaction. They were sort of ahead of the CAPS curve, if you will. So came to Icario and asked how we would rectify that. And we took this combination strategy that Louise has outlined here, where we were starting with emotion, not necessarily education, in order to both close the gaps and to improve member satisfaction overall by genuinely creating this activation energy and reducing barriers at the same time. We've got about a minute or so left before those of you who are moving on to the next would move to that next session. So we'll come up for air here and ask if there are any questions that we can answer immediately. Otherwise, we can also take them in the chat and follow up with them independently. All right. Hearing none, we will thank you for your time and let you go on to your next session. Have a great rest of your day. Just going to give another moment for folks to transition. And let's dive in. Good afternoon, everyone. I'm Cory Busse. I'm the Vice President of Performance Strategy